All right. Good afternoon, everybody. Good morning to some of you. I was told that the weather in Grand Junction, Colorado is nice today. That's good to hear. This is Ed Crowe. Appreciate you coming on today. I'm just going to waste a minute or here. Let some people come. We get a lot of people to come on at 1 or 1:01. So today we're going to talk about a new plan. It's not new, but it's newly available to agents. It's the United Healthcare IESNP plan. We're going to go over that today. A couple things just kind of that we go through every webinar just to mention to you before we get started is we do record all these webinars, so we will record it. The people who register for this webinar will get emailed the recording, even if you don't attend. But we'll put the recording on YouTube. We put all our recordings on YouTube. We've got hundreds of them up there. I put it on the slide, so at Crowe Medicare, that's our YouTube channel. And the recording will be up there this afternoon. I just took AHIP this morning. I do my usual annual AHIP test tip webinar where I kind of go over it, what to expect. Sample questions, pretty similar to last year, but I'll record that webinar just privately and put that on YouTube as well, so that'll be up there this evening as well. But today we're going to talk about the UHC IESNP plan. If you have any questions along the way, I'm not smart enough or talented enough or too stupid or whatever you want to say to answer questions as I go through the presentation. So I'm going to go through that and then I will answer all of them at the end for you. So our agenda for today, and this webinar will probably run about 20 minutes, like normal. Agenda will be, we'll talk about the plan, the UHC IESNP, which stands for Institutional Equivalent Special Needs Plan. Go over the benefits, state availability, who has access to this plan, who is eligible from a prospect standpoint, how you get ready to sell. And again, as I mentioned, we put all the webinars on YouTube, and we'll get started. And don't worry, if you have questions, I will answer them at the end for you, I promise. Or try to answer them. I'll address them, I should say. Not necessarily be able to answer all of them, but I'm going to try. So the IESNP plan, I'm going to hit the benefits first. It's a 5-star plan, which is great, obviously. It is approved in a lot of states, but right now United Healthcare, for reasons I'll talk about in a minute, they are rolling it out slow. The states where we can offer it are New York, Pennsylvania, New Jersey, Connecticut, and Florida. Quick caveat on Connecticut. It's ready to go. You can certify and get ready to sell it, but you do not want to sell it in Connecticut. Other states are good, but you don't want to sell it in Connecticut until the end of July. We'll send a notice out. The reason is they had to refile this plan to make it commissionable to us as agents, and that refiling needs to process. We will send a notice out when it does. So again, I'll say it, do not sell this yet in Connecticut. Or if you do, you're just doing it because you're an ambassador of goodwill, because you're not going to get paid on it. So wait until you hear further from us on that. It's a PPO plan design, same network as United's normal PPOs, same commission, so it's a regular commission. What's going to be unique about this plan is the out-of-pocket max. In some states it's $1,500, in others it's $1,600. I will go over the benefit summary too at the end. So $1,500 in some states, $1,600 in others. Depends on the state. That'll have a dental benefit up to $3,500 in some states, as low as $2,400 in others. It'll have anywhere from a $140 to a $200 quarterly OTC benefit, 36 one-way rides, $300 up to a $300 vision benefit, and a $2,000 hearing benefit. As far as availability, this will be available in a number of states, ultimately in every state. United is going to add numerous states that will be available prior to AEP. The reason they're going slow with this, and I'll get into this more, there's a clinical aspect of this plan that slows the rollout. It makes it hard for them, almost impossible for them to roll it out all over the place immediately. Well, I'll talk about that more in a little bit. So who can sell this plan? Well, this plan has been around in various states with United for years. It has not been commissionable to agents ever. It is going to be now. It is now. So any agent that goes through Pinnacle Financial Services, any agent or agency or affiliated agency partners, or any agent or affiliated agency partner of Crowe and Associates. This plan will be available and commissionable to you. Any other upline, any other agents, direct IMO agents, through other uplines, it will not be. So it's exclusive to Pinnacle and Crowe. So this plan is a special needs plan. It's available to institutionalized people and those that require assistance with activities of daily living. So as far as institutionalized, it's available to people that are in assisted living, people receiving home health care at home, people in memory care facilities, or independent living. So it's available to those people. It's available to both dual and non-dual members. And it also can be sold to people can be enrolled who live at home, who qualify based on needs. So if your client or prospect is not in assisted living, isn't receiving home health care, isn't in a memory care unit or in an independent living facility, it still is available to people, but they got to qualify a different way, and that's based on need. And that need is they got to have difficulties performing ADLs. I listed the ADLs as activities of daily living for you there, or an inability to perform IADLs. The I is out of that, but IADLs are things like basic self-care tasks that they can't perform or need help with. Examples of that would be housekeeping, managing money, food prep, managing transportation, medications. There's a wide list. So the point here being, this isn't just an institutional plan. It is a plan that's going to be available to a wide audience. It really is almost like a chronic needs plan. How do you check qualifications once this rolls out? And we'll talk about how you get ready to sell this in a minute. But how do you qualify the people and see who's available? Well, the first step will be to check on Jarvis. So you'll check for eligibility on Jarvis. If the person is dual or receives help, then they most likely will qualify. And if they do qualify, Jarvis will show that they qualify. It'll say they're eligible to enroll in the plan. So Jarvis is your first step. For those, if you check on Jarvis and they don't qualify on Jarvis, maybe they're not a dual, maybe they're not getting drug help of some level. The next step then is to do the needs assessment for them, which is with a company called WellSky. That's a UHC vendor. And they were a company that will assess these people to see if they qualify based on need, the things we talked about earlier. So once you're set up, basically you will online request a phone call from WellSky to the prospect. And same day, WellSky will talk to that prospect and verify if they're qualified for the plan. And they'll do it based on questions asking about needs. Do you need help with your medications, managing them? Do you need help around the house? Those types of things. They only verify the prospect one time. So once your prospect is verified that they need this help, they don't reassess them at any point. So once they're in, they're in. There is a clinical aspect of this plan, and that is what slows the rollout of it. So everybody in this plan will have access to a licensed clinician. That would be a nurse, nurse practitioner, or physician's assistant. Those people will be employees of United Healthcare. And they will do on-site visits, whether that's at the facility or at the home, on an as-needed basis, so in person. So they'll have a nurse, nurse practitioner, or PA going to their home as needed to assist them and help them. There will also be a care coordinator on this plan that will help coordinate the facility visits and access to other benefits on the plan. So given the clinician is an employee of UHC, and UHC needs clinicians available, it's part of the plan. They need clinicians available to see the members. They have to staff up in given areas to accommodate this plan, and that's the reason for the initial limitation on the rollout. That clinician piece is very helpful in a number of ways. It will definitely help a facility, so there's a value pitch here for a whole facility to accept this plan. It increases the average stay at an assisted living facility by 6 months. A greater benefit, or maybe more important to a facility, is it reduces the calls from friends and family to the facility checking on the member. The reason being is if there's an assessment done and that member needs to be seen by a clinician quarterly, monthly, maybe weekly, it has been proven to reduce substantially the number of phone calls going to that facility because they know somebody is coordinating this and that there's somebody seeing their family member, and it will reduce the calls as a result. And that's a very important benefit to the facility. Not to mention, it's very important to increase the length of stay, but also to reduce the amount of calls coming into them, which is a major responsibility they have. Okay, so how would you get ready to sell this plan? Well, if you're appointed with United Healthcare, you're lined up and you're appointed with United Healthcare through Pinnacle, an affiliated agency of Pinnacle, or direct to Pinnacle, or Crowe, an affiliated agency of Crowe, or direct to Crowe. And you have United Healthcare, then there's 2 steps you need to take. The first is to watch a video. It's about 25 minutes long. You watch the video and then you scan a QR code at the end. Once you scan that QR code, you fill out an attestation saying that, yes, I watched the video. Once you've done that, then within 48 hours after you've completed watching the video, the module will be loaded into Jarvis for you. It's going to be a certification that's in the invitation-only section in the Learning Lab. So if you haven't ever noticed that, it's because maybe you never had an invitation-only cert. So once it's added, you'll go into Learning Lab to do your usual annual certs, and there'll be an invitation-only request in there, and you go in there, and then you can do the certification for this product. Once that certification is completed, you are good to go, except for in Connecticut. Do not sell it in Connecticut yet until we send a notice. But once that certification is done, you're good to go. You can order supplies through Jarvis. You could call Pinnacle. You could call us. You will also get an invitation from WellSky to register. And WellSky, again, is the company that will do the assessment for people that you can't qualify through Jarvis. And that's WellSky will do the assessment to determine that they qualify based on need around the house, or completing ADLs to get in if they aren't verified through Jarvis for a dual or help standpoint. Once you're certified, enrollments can be done through paper. There are kits for this. You can order the kits through Jarvis. Enrollments can be done through Lean. And this product will also be added to Connector and Sunfire soon. So those who do enrollments through Connector and Sunfire will continue, once it's added, we'll be able to do these enrollments through Connector and Sunfire. So what's the bottom line on this product? Well, it's a product that has dual-like benefits, dental, vision, OTC, transportation, but it's available to both dual and non-dual members. Obviously, when you have a plan with an out-of-pocket max of $1,500, extra benefits, and the clinical component, we feel pretty strongly this is going to be a really competitive plan. Now, the plan does have a premium. It's about $35, a little less in some states, a tiny bit more in some. But if your client has any level of LIS, any level of drug help at all, it could be ALMB, QMB, SlimB, whatever it may be, it will cover the full premium of this plan. Even your clients that don't have drug help, if you really think about this, let's say you're in a state that has a higher out-of-pocket max, like $6,700, $7,550, they qualify for this plan. Even with a $35 a month premium, they're going to get all the extra benefits, the clinical component, and have a MOOP of an out-of-pocket max of $1,500 or $1,600. Pretty competitive offering. Okay, I was going to hit questions first, but what I want to do is see if I can transition over to well, there's my AHIP. Hang on one second. See if I can transition over and grab the link. Bear with me one second here. I'm going to show you what the benefits look like. Bear with me one moment. Here we go. I think I'm getting there, guys. Bear with me. Okay. Let's see. So what I want to do here is just show you what the plan looks like. Hopefully you can see it. I probably should have this link set up ahead of time. My apologies for that. Here we go. Okay. Okay, so we will send this link out to everybody that attended the webinar. We're going to blast it out anyway. But what it's going to show you is you're going to be able to see, just want to make sure you can see this. You're going to be able to see the plan. We'll send this out to you so you can see it. And it's going to have all the features, how to become ready to sell, how to sell the plan, meaning how to get people approved. And then this section here is going to have the various states and the benefits in each state. Now, remember, they're rolling this out slow, so it's not available in every county. So if we look at the different plans, New Jersey, for example, there's the counties it's available. Here are the benefits of the plan. Obviously, it's available in New York. It's going to be available in downstate and upstate New York. Available in Pennsylvania in limited counties. Connecticut's only going to be Fairfield and Hartford County to start. They will quickly add other counties to it as enrollment builds, and then Florida. So my point is you can go on this link and check everything out. And just a couple other things. If you want to become ready to sell, there's instructions on how to do that. We have screenshots of the whole thing in the QR code. How to sell the plan, meaning the two things I talked about, going in Jarvis to check qualifications, going into WellSky to see if they qualify from a need standpoint. If you scroll down further, there's other information as far as the plan. This is the job aid, which has all the details on the plan and how to enroll and all the steps. But I think you really don't need that. You probably can, you can reference it. But I think if you do the why sell, which shows the different plans, become ready to sell, and how to sell, that should answer your questions for you. Okay, let's see if we have questions. Go back to my presentation, the last slide of it. Let's see what we have here. Okay, we do have a lot of questions, so let me see. Somebody said, finally, an insurance product in New York that is first to be rolled out. Exactly, and I think it'll do very well in New York. I really do. I think it'll be a big product for us. And the more we enroll, it's exclusive to us, and the more enrollments we do, the quicker they're going to roll out the states. Next question was, does anybody who qualifies for this plan, even if they qualify for MSP or dual, do they have the ability to change plans once a quarter? Well, yeah. If you get any level of help, you can change plans once a quarter. But this is also a 5-star plan, remember, so you get an extra enrollment because of that. And then if it happens to be an institutionalized person, there can potentially be an enrollment period for that as well, if they're institutionalized or if they're discharged from the facility. Hopefully that answered your question for you. When states roll out, will there be a video QR code sent or available somewhere? Yes. So that video I showed you, how you can to get ready to sell, the video is the same for every state. So it's just a generic video you watch and do the QR code. The state doesn't even have to be available yet to be certified to sell this plan. But certainly, yes, as states and counties become available, and there will be multiple ones prior to AEP, we will certainly send out notices and keep you well aware of that. Do we have to certify to sell these plans annually? Yes, they're Medicare Advantage plans, so you got to certify to sell them annually. Somebody said, should I wait to certify for 2024 to avoid certifying now and then again in a month? That's up to you. I think this is a plan that you'll be able to sell fairly quickly, but then again, Connecticut, this won't be ready probably until the end of July. to pay commission anyway. It's available in the other states. It's available in Connecticut. You just won't get paid on it now. So, but I leave that up to you. Somebody said, well, if the doctors are not contracted with the plan, then that'd be the same situation with any Advantage plan. It's a PPO. It's United's normal PPO network, but if they're not in network, then just like any other Advantage, you would kind of look at it that way. Brochures available for presentations to nursing homes, etc. Yeah, so okay, that's a good topic you bring up. What's the pitch for a facility? United internally has been selling this, and they've been going into facilities. There is a massive opportunity for us not only to sell this to individuals at home and provide them with great benefits, but there's an opportunity for us to, as you alluded to go to the facility and pitch them on it, and potentially getting a lot of enrollments in one fell swoop. The value prop for that is being developed and will be sent out. How you would approach a facility and what the value is to them for the plan. Somebody asked, how long does it take for a doctor to contract with the plan? That is a good question. The answer is all over the board, however. It depends on a lot of things. They could be deemed, and it could go as quick as a few weeks. It could take months. Are the copays available anywhere? Yes, on that sheet, on that link I showed you, which we will send out, so you can see the copays on the plan. And you're probably referring to the summary of benefits. Yes, we will also soon have the full summary of benefits on there. Is there somewhere on Jarvis Learning Lab to see state availability? It's just those states that are on the link right now. More will be added. Okay. Can we check doctor's network on Jarvis? Yes, you'll be able to check the doctor network on Jarvis, but it's the same network as the PPO. So you just would look on the PPO network to see it. Does the plan have a separate network of doctors? No. It's the same as the PPO network. But again, that you'll be able to check on Jarvis on Connector and Sunfire as well, on Lean for the doctors of this plan. One quick thing to mention, this plan is this is a separate department through Optum of United. This plan will not, PhD Help Desk will not know about this plan. So Producer Help Desk will not be able to help you with this. This will be an internal thing. We do have a contact for this plan, but we're obviously getting more information. We'll have the summary of benefits for it. It'll be rolled out in additional states. My whole goal here is to let you know that I think it's going to be a big seller, and I think you should get certified to sell it. Okay, let's see if we got any other questions. I'll waste a moment here, just going over a couple things. AHIP, and then I'll just give you guys a couple more minutes to put some questions up. AHIP obviously is available. You can go on Pinnacle's website, pfsinsurance.com, and access it for the discounted rate of $125. So if you want to do that, it's pfsinsurance.com. Go to AEP Toolkit, and down on the left, you'll see the discount code. I took AHIP this morning, like I said. Past it, it's pretty similar, and I'm going to put a video up on YouTube about it this afternoon. So at Crowe Medicare to see the videos. All right, so we got a couple more questions. So somebody said in New York is a disaster emergency. What is the code for the SEP to put on the enrollment plan? Well, it's a 5-star plan, so you could use the 5-star enrollment for the plan. Somebody said, so any questions will go through us, correct? Yes, we will be answering questions once we have the answers, but we also have a dedicated rep from United that can answer questions as well. Somebody asked, how are the hours for home care services assessed? Trying to figure out how this plan compares to a MAP. I have someone on Health First Complete Care and they are not getting good enough home care hours. Well, remember, it's not, the clinician is not a home health care aide. So they're either a licensed nurse, registered nurse, or PA. It'd be like a doctor making a home call. They're not going to replace the need, really, for daily home aids, put it that way, or home health care. See if we have any other questions. Looks like that's all we have for now. I'll put this recording up on YouTube. We will send additional information to everybody who registered, including the link to the plans I showed you earlier. We'll definitely have the summary of benefits out, and then the instructions for certifying are on there. So other than that, I'm going to wrap it up. I appreciate you coming on today. Thank you very much. I hope everybody has a great week, and I hope to see you on a future webinar. Thanks.